2020 is the year of disruption. Just when we were all gearing for the new decade, 2020 disrupted our plans big time. We saw our lives and everything else come to a halt. Institutions that we thought were invincible all came crashing in just a few months or even weeks. The coronavirus, the unseen enemy, has invaded our lives, breaking down everything that we held on to, everything that was precious to us. The lives that we had carefully built over the years were torn to pieces in just a snap of a finger. Uncertainty filled the air, panic drove our anxiety, while hopelessness pervaded our hearts. We wondered, what does tomorrow hold for us? Our lives may have been disrupted, but we are still standing nonetheless. This pandemic may have brought us to our knees, but it has also made us stronger than we have ever been. And it is paving the way for our transformation, because 2020 is the year of new beginnings. It is the year where the slate has been wiped clean so we can all have a fresh start. It is time that we let go of the old so we can move forward with the new. This is the year where we allow ourselves to transform into the best version of ourselves. This is the year where we transcend our limitations and go beyond borders. It is the time when Voice Acting Academy transcends boundaries and goes global with the Certified Voice Artist Program. Because 2020 is the year of co-creation. It is the time where we acknowledge that we are not living as islands, but rather are part of a greater whole. This is the year where we have to accept the need to collaborate in order to move forward. The time is ripe to finally cultivate a safe space for both aspiring and experienced voice artists, where they can be nurtured and guided to live their fullest potentials. It is the year where we finally cultivate a new global community that promotes a culture of giving, loving, and sharing, because 2020 is the year of becoming. It is the time that we recognize the greatness of our potentials and finally step up to our higher calling to become voice artists who use their God-given talents to inspire, influence, and empower. This is the year when the Voice Acting Academy becomes a global community of voice artists who will use their skills to make the world a better place, one voice at a time. Voice acting is the art of becoming. I become. I believe. I am. Learn voice artistry only from the best. Join the Certified Voice Artist Program and learn the fundamental skills required of a voice artist. Voice variations. The Voice Master's formula for creating character voices, personal branding, and so much more. Study and collaborate with a global community of like-minded voice artists committed to using their voices to create positive social change. Visit www.certifiedvoiceartist.com for more information and to register.
Ayan, great day sa inyong lahat mula Luzon, Visayas at Mindanao at kung nasaan man kayo ngayon. Welcome sa premiere episode ng The Sunday Health Show. Ang show kung saan health is wealth. Makakasama nyo kami sa isang oras na puno ng kwentuhan at kaalaman patungkol sa kalusugan. Kami po ang inyong mga host. Ako po si Janine Santos, the Golden Voice. And right now, nagkakaroon po ng technical difficulty ang aking co-host pero I would like to introduce her. Siya po si Mitzi Aguinaldo, the Voice Royalty. So, napaka-exciting ng aming first episode and gusto namin kayong mabigyan ng magandang introduction tungkol sa aming show. So, magkakaroon kami ng iba't ibang segments kung saan magde-debunk kami ng tinatawag na mga common health myths. Ayan. So, I just would like to encourage everyone watching na if you have different myths na pinapaniwalaan and you want to know if it's real or not, please do comment them in the comment section. And kung gusto niyo magpa-shout out, ayan, welcome na welcome kayo. So, meron din kaming pag-game where you can actually win 100 pesos load. So, stay tuned. So, 100 pesos muna for this first episode. Habang tumatagal, magkakaroon din kami ng mas malaki pang prizes. So, okay. Ang galing din talaga kasi actually, ako ay isang registered nurse by profession and si Mitzi ay isang medical technology student. So, nagkataon na napunta kami sa show na to and buti meron kaming health background, di ba? Nakakatuwa lang din talaga si Doc kasi nabigyan kami ng opportunity. Of course, kay Voice Master Pocholo, nandito kami ngayon dahil sa kanya. Ayan. So, syempre, una kaming pumasok dito sa stream. Teka, pasok na natin ang aking magandang co-host. Ayan! Finally!
Hello!
Ayan.
Nahirapan po ako doon.
Okay. Ayan. Bati-bati muna.
Hello, good morning po. Ako po si Mitzi Aguinaldo, the Voice Royalty. Tsaka, tama ka Ate Janine, naririnig kita actually kanina. And ayun na, very exciting ang first episode natin. At dahil dyan, gusto ko po kayo mabigyan ng magandang introduction tungkol sa aming show. So, every Sunday, asahan nyo na po na meron po kaming iba't ibang topics na i-cover. And of course, magkakaroon ng meron po kaming pag-giveaway. So, dapat makinig po kayo sa unang-unang parte pa lang. Tapos, meron po kami ng mga health calls wherein meron po kaming tatanggaping video, ipi-play po namin and sasagutin ni Doc yung kanyang katanungan. And at dahil dyan, sa mga katanungan, we highly encourage our dear audience din to share their insights or magpa-shout out sa comment section. Meron din kaming pag-game where you can win 100 peso load, so stay tuned.
Amazing. So, ito na. Let's welcome na ang ating main host na sobrang bigatin talaga. And excited na kaming marinig kung ano ang story niya. Ayan. So, let's say this tagline na. Finally, the doctor
is in.
Ayan, let's welcome.
Presenting celebrity urologist, Dr. Joseph Lee.
So, ayan.
Great day, great morning, and to two beautiful co-hosts. My co-host, alam mo, hindi ko alam kung kakabahan na ako. One is the Golden Voice and the other one is the Voice Royalty. I do not know what kind of voice I have. Anyway, kagaya ng sinabi ni Janine at sinabi ni Mitzi, sa ating nanonood sa online ngayon and our viewers, dapat manood kayo at tumutok kasi bubusugin natin ang inyong tanghali bago kayo mag-lunch.
Yes.
Because this is Dr. Joseph Lee, your urologist and medical consultant here in the new Sunday Health Show. Binagal ko talaga. Okay, before we start, you introduce me in a bit, sabi nga ni Mitzi, I like to know how are you both? Kamusta naman ang weekdays nyo?
Ayan. Oo nga, Mitzi. Parang nag-start ka na ata ng iyong classes. Kamusta ba yan?
Yes. Opo, actually nag-start yung online classes po namin this August lang, and I must say hindi siya madali because there were a lot of adjustments to be made kasi hindi po yun yung nakasanayan naming gawin. So the only thing I had to do was to become adept, and yun na nga, survival of the fittest po ngayong new normal. So
Yeah.
we just really have to survive. Ayun.
Kudos talaga
And-
sa mga students natin kayo.
Oo. Di ba, Janine, meron yung sinasabi na ngayon siguro Mitz will agree with me. Asynchronous and synchronous learning.
Yes. Opo.
Before kasi yung time ko, face to face. It's more face to face.
Opo. I really miss that na po actually.
Yes. So, and we're hoping na bumalik na lahat sa normal. Kasi itong new normal na to mahirap talagang pag-adjustan. Diba? Well, ako naman, just would like to share na we really worked hard on the preparation for this show. Kaya nag-tech run pa kami ni Mitzi kagabi actually.
Oh my God.
Actually, I like to butt in, no, girls. Okay. I'm very privileged to have one millennial beautiful host and one Gen Z beautiful host.
Yes.
My God. Yung millennial
Gen
kasi
Z.
sabi ni Janine siya. Ang Gen Z, si Mitzi. Ako, ano na tawag? Centenaryo. Pero this is the most privilege of me to tell our online viewers today na you accepted my offer to be my co-host.
Ay, ako po, thank you po. Actually, we're so privileged din po talaga na
Opo.
mapunta dito. Nakakatuwa lang din, Doc. It's an honor to be a co-host of a celebrity urologist. Akalain mo yon.
Tsaka health show, super related sa profession ni ate and sa magiging profession ko po.
Oo.
Wow. Very exciting. So, ito na nga. Para sa aming pag-game. Ito na sa mga nag-aabang dyan sa ating 14,000 viewers. Oh my gosh! And then marami na rin pong nagpapa-shout out. So, sige, bago ko i-announce itong mechanics ng game na to, pakita muna tayo ng mga bumabate. Batiin muna natin. Ayan. Unang-una, Kilala siguro to ni Mitzi. Lance Padilla.
Hello, Lance. Thank you for watching.
Ayan.
Good morning, Lance.
Ayan si Lil Sis. Si Kate.
Ate
Yay,
Kate.
show. Hi, Kate. Part of PVG, fellow PVG.
Opo.
Okay, isa pa tong tawag dito, bigatin din pagdating sa voice acting. So, ito naman. Kilala natin Papalem. Excited na kami ni Doc. Doc Joseph, Janine, and Mitzi. Ayan. OMG. Ito na nga. Sabi. OMG. Ito na nga.
You know what's nice about our health show? Because it's so millennial and so Gen Z. And I'm joining your group.
Thank you, Doc. Ayan, hello, Big Sis, Mitzi, at Doc Joseph. Grabe ang support
Hello
nila,
po.
nila Kate and ni Papa Lem. Thank you po. Woo! Ayan, kitang-kita nyo naman. Hype, hype, hype. Ito pa, isa pa to, Yan, Yan, hello, Nurse Janine, the golden voice. The golden nurse.
The golden nurse.
Okay. Tapos, next one. Ito ay Great Day to Sunday Health Show. Ayan, ang ating magaling na script writer.
Yes. Kasama natin niya sa team.
Mm-mm.
Good morning,
Saan
Ivana.
ko? Right. Yes, good morning, Ivana. Yun. Gusto ko yung golden nurse with the golden mic. Oo nga, ngayon ko lang din talaga ginamit tong mic na to. Kasama ko
Hindi
sa
sinasadya
Saktong-sakto.
yan.
hindi po
Saktong-sakto.
sinasadya yan. Oo, saktong-sakto. Ayan. So, dahil dyan, mukhang ang dami ng comments. OMG, sige, mamaya na natin basahin to lahat. Pero maraming maraming salamat po sa mga nagsha-shoutout and sa mga nagko-comment. Meron na rin mga nagko-comment
Opo.
na kanilang insight. So, ituloy na natin tong tanong. Ito ang aming pag-game.
Hmm.
Ito yung tanong. So, we will give 100 pesos load. O, lalaki pa yan in the future ha. So, stay
Yeah.
tuned to an audience who can answer this question correctly. So, all you have to do is type in your answer sa comment section as well as share this live. So, tandaan, comment the correct answer and then share this live show. Ayan. And then we will pick out a lucky winner and announce at the end of the show kung ano yung tamang sagot and kung sino yung winner. So, ito ang ating question. Ayan, nawala ulit si Mitzi. Anyway, ang question natin, ano ang specialization ni Dr. Lee? So, kanina pa namin siya binabanggit. Once again, sa mga hindi nakakuha nung tanong, ito po. Ano ang specialization ni Dr. Lee? Sobrang giveaway na niyan, guys.
Oo, Janine, no? Di ba? Talagang kung nakikinig ka and you started watching us kaninang 11 o'clock, alam mo na yung sagot.
Oo.
Opo.
Oo, pag ganyan
Yung
ang
mga
premyo,
poster.
mag-uunahan kami ng gate. Sige, sige, go, 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 go. Ano ba to? Paparoleta ba natin to para
Sino po ba
mamaya?
yung Sige, mamaya.
Mamaya.
We'll know that later.
Okay,
But we're
yes.
very soon. We'll get sponsors. I think I have a few that are joining our show. And there will be more prize tags. Yon.
Yan. Sobrang
Yes. Ayan. So, dahil the doctor of the show is finally in, let's get to know the main host of this show more. Ayan. Take it away, Ate Janine.
O, sige, Doc, simulan na natin ang tanungan. Ikaw muna.
Parang kinakabahan yata ako.
On the spot ka muna namin, Doc.
Oo. Hot seat.
Alright. Sige, tanungin na natin na hot seat si Doc. So, unang tanong. So, what made you decide on becoming a doctor? And paano kayo naging celebrity doctor? Ayan. Yung una nating tanong.
Initially, when I was a child, I liked to become a marine biologist. I'm always fascinated with Jacques Cousteau. I don't know if you knew the guy now. He's a very famous marine biologist in the States. Okay. Then after that, I wanted to become a veterinarian. But because my parents wanted me to become a doctor, that is where I went into become a medicine man. Okay. Now, with regards to your question on being a celebrity doctor, I don't really consider me as a celebrity doctor. You know why? Because I used to think that it is a label that is given by people like you, no, Janine, si Mitz, or other people who have seen you in the television. I've heard you in the radio and so forth. So up to this point, there is just one person I asked, which is our mentor, Pocholo. When will you be labeled as celebrity? Okay, this is what he said. If you will be approached by somebody who you don't know and ask for your signature or picture, then probably you are a celebrity in status already. Okay.
Grabe.
And there were a lot of products that came to me that they want me to endorse. And that's it.
You actually go ahead and check out yung profile ni Doc sa FB. Siyempre, pinlag, no? Puntahan niyo na yung profile ni Doc para makita niyo. Ang dami
Stalk.
niyang schedule ng shows. Kung ano-anong
I-stop
show.
nyo na
Parang
daw.
yung buong linggo. Uso yan stalking. So, i-stalk niyo na si
Oo
Doc.
nga.
Tapos tignan niyo. Parang buong linggo yata meron siyang show.
Yes, meron
Monday,
niya.
Tuesday, Wednesday, Thursday, Friday. Tapos meron pa siyang photo shoot on the side. Marami pa siyang ini-endorse na products. Tapos sasabihin niya na hindi daw siya celebrity. Okay. Hindi. Pero super idol namin yun si Doc. How do you do it?
Yes.
How do you juggle everything, di ba, Doc? Pero before you answer that, tanungin naman natin muna. I think si Mitzi pala may tanong. Si Mitzi
Yes.
muna.
Okay
Excite
po.
ako.
Ako naman po may tanong. Why did you choose urology as your specialization?
Oo.
My mentors were great in training me during my residency. So I felt that this was the specialty that I will be training in the future. Before, urology was not really as favorable or fantastic as a specialty like your plastic surgery. It is just now that a lot of people are recognizing it. Then I think it's more recognizable as a specialization.
So, Doc, could you give us and of course our viewers kung ano nga ba ang urology? And ano bang tinitreat?
Okay. Lagi natin sabi Janine tsaka Mitzi, ang urology ay hindi neurology because it sounds the same, similar, right? So neurology is about the head, the brain. Urology is about the reproductive organs, especially on the male, but we have on the side for the female. Okay. So urology deals with kidney, ureter, and bladder, the prostate, the fertility aspect of the male and female.
Okay. Ayan. So, nabigyang nabigyang kaalaman na po ating mga viewers na hindi po siya
Yes.
neurology. Magkaiba po yun.
Oo.
Ayan. So, thank you, Doc, for that answer. So, I just would like to ask din pala, meron po ba kayong, ano ba yung mga treatments na na-administer ninyo sa mga patients as a urologist?
Okay. Basically, Janine, what we treat is for the urogenital diseases. Okay. So kidney problems, ureter problems, prostate problem. Okay. So we deal with kidney stones and urogenital stones, a lot of mass, UTI. With regards to the prostate, you have your enlarged prostate and the rest of the urogenital cancer. Okay. Now, I went for a subspecialty with regards to urology, fertility, and sexual aesthetic.
Okay, ayan. Thank you, Doc. So, alam nyo na kung ano yung mga treatments and kung ano yung mga problems na tinitreat ng isang urologist. I think Mitzi has
Yes.
a question then.
Yes. Tsaka, di ba kung meron tayong OB-GYN for women, so yung
Yeah.
mga lalaki, they go to the urologist. So,
Yes.
yun na nga po. So, Doc, in your opinion, and sa practice nyo po, when do you think should we consult a urologist?
Very good. You know, Mitzi, in this generation, like generation in Janine, in generation mo, most of the time, I was telling Janine, you get your medical knowledge or your medical consult to your friends, or you look into the Google or Wikipedia, whatever you have. Okay, magagaling kayo dyan. Okay. Now, basically, if you have symptoms that are unnatural, meaning, example, difficulty in urination, nahirapan kayo, balisaw-saw. Alam mo, you know that. Very simple. And what is the first thing that you will think in your mind? Urinary tract infection. Diba? Anong gagawin ninyo? Minsan kasi, pag bata kayo, kagaya ng generation nyo, anong gagawin nyo? Iinom lang kayo tubig. Diba? Or you don't seek medical consultation. Diba? So, yun ang ginagawa natin. So, basically, to answer your question, Michi, if you have anything that is not normal within your body and you feel that it is within the urogenital system, then you seek medical consultation.
Ayan.
Yes.
Bigyang linaw
And
na.
I guess
Huwag na
that's where,
mag-self-medicate.
opo, that's where, sa kanila tayo isa-suggest sa specialist.
Tama. Kasi marami sa atin, kadalasan sa ating mga Pilipino, we're not used to actually going to our doctors or magpapacheck up.
Exactly.
Madalas sinasabi, wala lang yan. Tapos magugulat na lang, malala na pala. Kaya yun. So, it's very
Hindi kasi,
important.
Janine, matiisin tayo as a Filipino, di ba? Especially for
Opo.
some reason or another. Parang hindi muna, ayaw ko pumunta sa doktor, di ba? Mukhang kaya ko naman i-resolve ito, di ba?
Yes.
Or, may iba kasi, sabihin nila, naku, pupunta ako sa specialista, ang mahal-mahal ng consultation, di ba?
Correct.
I rather buy something else, di ba? May iba nga, alam mo, midsis, sabihin nila, bibilin ko na lang ng load yan or internet load, di ba? I don't know, you have to debunk me if I'm wrong, no? For the young generation.
Yes.
Oo po. Actually, kahit naman ng dati pang generation, yung mga parents din, and ako, as a nurse, I've handled so many elderly na mga patients. So, madalas ganyan, magugulat sa mga kwento nila na nandito sila sa ospital ngayon kasi hindi nila pinapansin yung mga symptoms na nafe-feel na nila noon pa. So, nagsimula na parang mild lang, binabaliwala, hanggang sa lumala na, and doon na. Pag malala na, doon na lang magpapakonsulta. And mahirap yun. Diba? And of course, it's important na we make sure na we're healthy, we keep track of our health kasi prevention is always better than cure.
Exactly.
Yes.
It's important na you have parang kahit tawag dito, every 6 months ba? Correct me if I'm wrong, or every 3 months man, nakakapagpa-check up ka, yung overall mo makikita kung meron na palang problem or not.
Or you can do it, Janine, annually if everything is okay with regards to your blood workups, other diagnostic like ultrasound, then you can do it like an annual exam. That's okay.
Ayun. So, annual
Yes.
exam naman pala. Yan. Kasi magastos din naman talaga magpa-check up yung mga blood works and everything else. And yung, syempre, medyo
Maswerte na lang kung meron po kayong card, yung health card.
Oo, exactly.
Correct ka dyan, Mitzi.
Magastos. Yun talaga ang magastos yung mga laboratory exams. So, eto, I want to ask Dr. Lee na how is it working as a doctor during the pandemic? Kasi syempre, it's very different ngayon. Grabe, saludo talaga sa mga frontliners. So, yan.
So, sa panahon na lahat kayo ay naka-quarantine, it has been 8 months. So, I was out working, doing face-to-face, all battle-geared up. When I say battle-geared, face shield, face mask, PPE, diba? So you have to have gloves, alcohol, okay, and you have to always disinfect yourself. Ano pa mga gear ko. Ngayon kasi may bago ako, Mitzi, may pang oxygen. Yung parang it's a device wherein so that you can breathe when you have mask. Kasi most of the time, matagal
Oh,
kami in the clinics o sa operation. There is a device now you buy. Oh. Pero pag hindi naman kayo sa hospital, you don't need that. No? Kasi the longer time we stay in the hospital or the clinics, sometimes kasi wearing the mask, it's kind of difficult to breathe. Okay, I guess I know that is your concern also as young girls, you know, and working girls, especially kasi si Mitch kasi online yan studies Pero si
yes
Janine,
po.
sometimes I think there might be chances that you go out because you work. Oh, so nakamask kayo, di ba? Yung face shield lang, minsan nagre-reklamo na kayo. Di ba?
Actually, Doc. Pero yun, buti na lang. Actually, ano po ako ngayon, home-based. So, at least I don't really have to put on battle gear every day. Kasi hindi na ako nagpa-practice ng pag-nursing for now.
All right.
I have to stay at home.
But the
Home-based
watch
work.
you see Janine and Mitz sa television, like the white one, the PPE, the one, the minsan may goggles pa kami. Oh, that is what we wear. The same thing, okay. Now, kung tatanungin mo ako, Mitz, Janine, kung natatakot ako, of course, I'm scared. You never know, di ba? It's a virus. You don't see it, right? So anytime, it can follow you sa bahay mo. Hindi mo alam, di ba? Sabi niya, gusto ko yatang dumapo sa'yo, di ba? Pagpunta mo ng bahay, if you do not have that proper health protocol, ayan na, tatamaan ka na, di ba? Kaya we have those answers.
Imbis na
Yes.
yung crush mo yung ma-attract sa'yo, yung virus yung
Yung
na-attract sa'yo.
virus.
Oo. Kaya lagi ko sinasabi sa inyo, Mitch, Janine, and all the people, no, especially the young individual. This is an advice for somebody who's elder than you. Increase your immune system. Okay, make it strong. Try to sleep. If you need the sleep, alam ko kasi kayo, nakatuto kayo online. Netflix. Grabe. O ayan, isa. Ayan, papatulog yan.
Doc, vitamin C.
Vitamin, kala ko,
Yes.
very good yan, vitamin C. Tama yan. So, vitamin C, eat well, wag masyadong conscious muna sa weight, no?
Ay,
Because
opo.
if you are healthy, takot ang virus. Pag bumaba ang immune system mo, tatapuan ka ng virus. Kahit na anong edad ka.
Opo.
Wow. Maraming salamat po sa reminders. I'm very sure yung mga viewers natin talagang nabubusog na sila ng kaalaman and ano din sila, na-remind din sila about what
Yes.
to do and how to make sure na maganda yung resistensya ng katawan nila during this time. So, may last question si Mitzi.
Yes po, last one. Doc, if you were not a doctor, what would you be and why?
Yes,
Parang Miss
beauty
Universe.
contest pala.
Parang ano to pa? Maging singer kagaya ni Janine? O maging voice royalty kagaya ni Mitch? Joking aside. I think I would not want to change my course even up to now. Okay. Actually, my being a medicine man has been so fulfilling. I've been practicing for 20 years. Can you imagine? Okay. Haven't asked that question, Mitch, I will still pursue to become a doctor after I have experienced everything, no? Especially now, yung COVID pandemic, no? It's a very challenging thing, no? Those that I mentioned a while ago regarding marine biology, veterinarian, no, probably those are passions you have when you are a kid, no? But now that I've been a medicine man for the last 20 years, I will probably repeat my course
Wow,
in the
that's
next generation.
dedication. Grabe.
Okay? Did I answer your question, Michi?
Yes, Doc. Grabe yung dedication.
Grabe yung
Ah,
dedication. And wala, saludo lang talaga ako kay Doc. So much admiration for him. Kasi grabe ang patience ng mga doktor and hindi madali na maging nasa medical field. Grabe,
Opo.
tuloy-tuloy talaga ang pag-aaral niyan. Kaya
alam mo,
dahil
Janine,
dyan, yes
alam
po.
mo, Janine, Mitch, kala ko tatanungin nyo, paano ka naging doktor, saka naging celebrity doktor? Paano mo ginagawa yan?
Yun nga, Doc. Oo nga
Oh,
pala.
di ba? Oh,
Naalala ko.
How
Pagka
do
nag-
you juggle?
Opo.
time
Paano?
management. Time
Oh
management.
my.
So, my free time, di ba, Heb, kung masisingit yung media, kagaya nito, I make it a point that I give it time. You know why? I enjoy doing this platform because I feel that it makes me a whole individual. All right? Hindi kayong isang box na, are you doctor, doctor, doctor? Morning, doctor. Lunch, doctor. Paggabi, doctor. And the next day, ganyan. And you will live it like meets for 30, 40 years. My God. Parang feeling ko maboboard ako. But
Yes.
siguro, to my colleagues who were saying, how do you do that? Because it makes you whole because you have fun, you have happiness because you have doing this, and it is an opportunity that's given to you. And like now, how can you be more happier when your hosts are young? Diba? Diba? Can you imagine? Sasamahan nyo isang doktor na edad ko, and that makes you more ageless. Yan ang sinasabi. Diba?
Wow.
Yun.
Namirin ko talaga. Sobrang, we're so honored na kayo po yung aming host dito and we actually get consultation from a celebrity urologist. So, ang galing. Kasi
Opo.
hindi lang ganon, hindi lang expert advice when it comes to health. Pati, ayan, no, it's very inspiring kasi most of us, na tatak na sa isip natin na we have to be in this one profession only and
Yeah.
mahirap ipagtaba yung ibang profession. Pero, Doc shows
Yes.
a great example of someone who juggles both and doesn't live by just the rules na ganyan lang. He lives outside, parang outside the box. He thinks outside the box, kumbaga. So,
Exactly.
Ayan, alright. So, very grateful. Parang yung main host natin, ginawa nating guest for today. So, palakpakan naman dahil na-on the spot natin si Doc. Ayan.
You know, I'm in I'm enjoying your questions, no, so that the millennial people and the Gen Z people would know our generation, okay, especially
Yes.
me, okay. Now for you, before we go on with your other topics, kasi is like you go forth with your dreams, di ba? Kayo kasi masyado kayong straightforward, aggressive. You go forward. Kung may opportunity, di ba, Mitch, go. Ginagaya ko kayo.
Wow. What an
Diba?
honor po talaga. Ayan.
You inspire me.
Likewise,
Wow.
Doc. We're very inspired.
Yes.
Galing. So, yung team natin actually parang family. Small team pa lang kami, pero it's just amazing working with these people. Tulong-tulungan talaga. So,
Opo.
ayan. Let's move on to our next topic kasi marami
Mhm.
pang sasagutin si Doc when it comes to
Opo.
mga health questions. Nakikita ko na nagpa-pile up na dito yung mga bati, mga tanong, mga sagot sa tanong kanina. Mga gustong manalo
Opo.
ng 100 pesos na load.
There's a load.
Ayan. So, ano muna tayo? Bati-bati muna tayo.
Okay po. Ay, si Mommy Abby. Hello, darling bunso Bitsy daw. Kasama ko po sa Voice of the Parent Show.
Amazing. Ito naman.
Kuya Brian Dave Perez.
Tama din ang batch 3 ng CVAP. Yun. Sa dami ng mga comment, hindi ma-post lahat.
vlog na kayo.
Oo. OMG, kailangan po ba maganda at pogi din yung viewers? Nakaka-pressure, Doc. Napakagandang viewer naman ito si Kate.
Oo nga po
Grabe,
eh.
diba?
Good
Kaya
morning,
nga.
Kate.
Yan, good morning. And ang hirap mamili ng comment. Hindi natin ma-post lahat. Ang galing. Ang daming nanonood din. 27,000 all over the world. Ayan, si Kat Lata ng Batch 2 of CVAP and host din ng Voices on the Spot. Hi, Kat! Ito, and syempre sa ating
Siyempre, si
Hi,
Idol.
Sir Choi. Hi,
producer.
sir.
Oh, hi,
Good morning
sir.
po.
Congrats, Doc Joseph Lee and the team. Janine Santos and Mitzi Colin Editor Aguinaldo. Ang haba pala ng name ni Mitzi.
Full name.
Full name.
Dami dito. Ayan, oh. Health is wealth. According kay
Ito, Sir Chase.
Sir Chase. Ayan. Kasama din namin siya sa CVAP batch. Okay. Ang dami ditong comments. So, guilty daw si Kate. In water daw siya. O, di ba marami nang natatamaan ngayon sa...
Ako ba yung pala?
Drink your water. Don't forget.
Drink water.
Yan. Dahil dyan, mag-move on na tayo sa ating next segment. So, bigyan muna natin kayo ng updates about COVID-19. So, kung ano nga ba ang ngayon. Okay? Muna tayo sa COVID-19. All right. So, this is our data according to the data from the Department of Health. So, this is this day lang din as of 12 a.m. 393,961 infected plus 2,157 cases. And Mitzi?
And we have 7,485 deaths naman as of 12 a.m. din. Grabe, dagdag 24 cases.
And on the bright side, we have 350,216 recoveries. This is once again as of 12 a.m. this day, November 8th.
That's really unfortunate, no? I just hope na ma-resolve talaga agad tong COVID kasi it affects not just our health but also other facets of our lives. Pero moving on, ano nga ba ang kamakailang balita na nagpainit sa online world?
Ayan, so
ano nga ba?
Ano nga ba? So, malalaman na natin. Meron usong-uso ngayon to eh. Although, hindi naman na talaga siya latest news, pero so far, ito talaga ang pinaka naging maugong na news for some time.
Opo.
Ayan. So, let's flash
Okay.
this one.
Ayan. Well, apparently, nagkaroon ng heated argument sa pagitan ng mga celebrity doctors na sina Doc Adam and Doc Farah dahil sa pag-call out ni Doc Adam sa slimming coffee na glutalipo.
I know Dr. Farah, no? He has been controversial even in our country, no? I think he is I don't know if he's a lifestyle doctor or a herbalist, no? He uses a lot of herbal concoctions. Okay. Hopefully, some of them have been approved by FDA. Hopefully, I'm saying, kaya siya naging controversial, no? But the thing is, he has a lot of patience that I don't know if were cured with their complications or their diseases. Kasi I think Janine Mitzi, she left the country because of some cases. Oh, di ba? Nagulat kayo. Hindi lang yun. Oo.
Kaso din pala talaga.
Yun yun, pinursuyan ng mga doctors. Oo, kasi nga may sinasabi nila, she's prescribing something that is not within the realm of the medical practice. Okay. Nagulat kayo? Ako
Yes,
nagbigay
opo.
ng breaking news?
breaking news. So kahit kami nagulat, di namin alam yun. Na talagang
Oo.
hindi lang pala si Doc Adam ang nag-call out sa kanya.
Opo.
Marami na rin pala talagang nag-call
Yes.
out. And may sinasabi nga din po na nag-take daw siya ng online course sa Harvard. Parang ganon. May mga
Yes.
about her daw. And marami talagang bumabatikos in that sense kasi parang hindi enough yung training mo para masabi mo na parang credible ka in that field. So, anong masasabi ni Doc about this?
Okay. Pinaglabang niya yung online course sa Harvard. I also did online course in Harvard. I just finished it during the pandemic. Oh, it's global health and health policies. Okay. My take on that is like, if you take online courses, unless it's a full course with certification, then it could be a count for your credentials. Okay. But it cannot be suffice, especially if you're practicing in medicine. It has to have a backup of researches. No?
Yes.
If you're trying to prove something with regards to your resources, ibig sabihin ng resources niya, yung mga ginagamit niya pang gamot, meron bang backup ito ng science, research, and approved agencies para it would not cause harm to our people.
So, talagang para sa ating mga viewers, para sa ating lahat, it's very important na tingnan natin yung background ng mga products na binibili natin.
Yes.
Kasi akala natin na we're buying these products sana para for our health and wellness, pero yung pala may mga side effects na hindi natin nakikita. So parang katulad ng kwento na narinig ko when I was still in college, merong mga na-admit dahil dun sa pag-inom ng slimming tea, malalaman na nag-shrink daw pala yung kidney nila later on. So, diba?
Iba yung pumayat.
Nakakatakot. Magugulat ka na lang, ma-ER ka, yun pala. Yung kidneys mo, nag-shrink na pala. You weren't aware and you think na it's very healthy. Kasi tea is supposedly very healthy for us. I have another question pala kay Doc. Kasi in relation to this topic, meron ding certain person na nagpapanggap na dermatologist and marami na nagagalit about that kasi sinasabi niya, kiniklaim niya na isa daw siyang dermatologist and nag-aral daw siya sa UST and he has edited
ito yung may salon ate, no?
Oo, na nagbukas daw siya ng clinic and magugulat ka na lang kasi doktor na siya pero parang 2 years lang daw, ganyan. So, I want to ask Doc, ano ba ang pinagdadaanan ng isa talagang doktor? Ayan, kasi unfair for those
after medicine, you have your certification board. If you're licensed, you are called a general practitioner. If you finish any residency training, you will be certified on what specialty you have. Okay. Now, if it's dermatology, you have to have 3 years of internal medicine and 1 or 2 years of dermatology specialist. So ngayon, sabi mo, Janine, 2 taon? Is that enough? No. Okay. Certification, you have to look into the certification. Baka certification lang kasi nag-attend ka, 1, 2,
seminar.
3. That's not enough. Okay. Diba? Kailangan may training. Like kayo, diba? You all went to master or mentor Pocholo's creative voice training, diba? Meron pa kayong mga modules, may mga tests, mga ganon. Diba? I know that. So, yun ang full course of whatever specialization you have, no? Now, for doctors kasi, depende kung anong kukunin mo. So, it's not enough, nag-attend ka lang, Janine, meets, ng isang araw, 2 araw, ay, expert ka na. No. You have to be very careful.
Exactly po. Nakakatakot din talaga kasi we've been hearing a lot of stories going to doctors daw who does beauty treatments and then magugulat ka na daw mo yung
Yes.
mukha ni ganyan. Ang daming mga news about that.
Oo.
Yes.
Tsaka
Well,
alam mo, Janine,
Yes po.
gusto ko ito kasi you are my host. You are on your generation. We can expound on this wherein your generation population will ask you, tanungin nyo nga si doktor kung pwede ganyan. Kasi most of you young people, if you don't ask somebody who is knowledgeable, you will buy the product. Iinumin mo yan. Sometimes your parents don't even know. Do you agree with me? O si Mitzi muna, parang gusto niyang may sasabihin siya. Tama ba yon?
Well, yeah, at some point kasi minsan, 'di ba, Doc, kunyari, nagpa-check up na tayo before, and then yung kapag gumaling tayo dun sa binigay na prescription ng doctor, 'di ba, we would often believe na, okay, so gumaling ako dito. So the next time na magkasakit ako ulit, ito na ulit yung iinumin ko. Now, for normal for people who are not in the medical field, they are not aware na may mga certain levels yung medicines na kaya gantong antibiotic yung binibigay sa'yo muna kasi ito yung sapat dun sa severity ng sakit mo.
Exactly.
Ayun
At
po.
dahil dyan, gusto kong tanungin si Doc ng isang controversial question
Oh.
na masisegue na sa ating main topic. Dahil nabanggit
Okay.
na natin si Doc Para, Doc Adam, and all that controversial news, isa lang ang tanong namin ni Mitzi. Ang repolyo ba ay nakakagaling ng sugat?
Natawa ako.
Inaabangan din natin 18,000 viewers.
Where
yan
did you get
talaga.
that idea? I
Doc,
do
kasi
not know what
nasa news din
Okay.
siya. May
This is the thing.
na-
Okay. So far, yung mga plant-based natin kasi, ang magagaling lang dyan is yung, at approved by DOH. Yung mga malunggay, diba?
Opo.
Ang palaya, ano pa ba?
Pero Doc,
Tomatoes are very
itong
good.
repolyo na sinasabi ko nakakagaling ng sugat, tinatapal nila sa sugat, Doc.
Actually,
No,
hindi
there
lang daw
are-
sugat.
There are herbal leaves that you can do that. No, I'm not
Opo.
worried about the names. But this is something that is new for me. Repolyo talaga. Di ba pang salad yun? Kayo talaga. Para napaisip tuloy ako.
Sabi pa nga daw sa
Pagkain
part
talaga.
na namamaga, mawawala daw yung
sa part
nana.
na namamaga. Pati nana mawawala daw.
Aloe
Naku,
vera
naging
can
salad
do
na
that.
talaga.
Aloe vera can do that. I don't know about repolyo. Because repolyo kasi is a vegetable that is water absorbent. Diba? Pag kinain mo siya na marami Mitzi, Janine, parang nabubusog ka kasi nag-absorb siya ng tubig eh. Like, kumain ka ng isang dish na daming repolyo, tapos ang daming sabaw, di ba? You mix it with soap, right? Di pag soup. Pag kinain mo, para mamaya, busog na busog ka na.
Busog.
Kasi
Yes.
nag-absorb ka ng tubig. Pero I don't know if it its healing power. No? So, I think we need to look into that.
Ayan. So sa ating mga dear viewers,
Careful,
alam niyo na,
careful.
pang salad na lang po. Wag na muna po nating itapal sa ating
Oo.
mga sugat. Kainin na lang po natin ang repolyo.
Pwede bang pamukayan? Tapal
Yun
mo
nga,
sa
Doc.
mukha.
Diba dati pipino?
Di ba, Mitz? Pwede mo ilagay pipino, tapos lagay mo yung ano.
Saka ng salad talaga.
Nadagdagan na yung skincare.
Oh,
Bagong
skincare.
skincare po. Pero joke lang po yun. Baka, wag
Oo.
niyo pong itry. Wag niyo
Opo.
pong gawing
Sundin
salad.
tayo niya.
Skincare. Patay tayo dyan. So, ayan.
So, yan.
Mm,
So,
okay.
basta the bottom line is, you should take diagnosis only from professional doctors kasi they know what's best for you.
Mhm.
That is correct. And marami din talagang nag-self-medicate. And
Mhm.
iba-iba ang paniniwala pagdating sa health and medicine. So, I just would like to ask Doc again, meron po ba kayong narinig na parang weirdest myth na narinig nyo sa isang pasyente and, did they ever try treating themselves or parang nag-self-medicate sila or anything else na pinaniwalaan nila kasi talaga yung belief?
Example na maalala ko, pag tumalon-talon ka daw, tatangkad ka daw. Pag
Every
genetically,
New Year yan, no?
di ba, myths, pag genetically, when you say genetic, ang lahi mo talaga, hindi naman katangkaran, hindi ka natatangkad. If you want to achieve a 6-foot person, individual in the future, baka hindi mo ma-achieve yan. Ilang taong ka tatalon. No, that this is parang myth na sinasabi na maari, but it might not give you your perfected goal because it's genetic and depending on your bone structure. Okay. Meron pa ba ibang myths? Yun lang maalala ko.
Ayan, thank you, Doc. Ayan, yan pala ang kanyang mga narinig na myth from patients. And actually, kahit tayo, common myths na yan eh. So, let's delve in further or let's see further kung ano pa ba yung mga common myths. Napakadaming myths, pero ito lang talaga yung most narinig natin. So, let's proceed.
Yeah, let's proceed. Ayan, here are the top 8 health myths. Top 8 kasi November 8 yung first episode po natin. So first, cracking your fingers causes arthritis. So ayan, to be sure, cracking your fingers is no way to make friends in a quiet library. But the habit itself won't give you arthritis, at least not according to clinical studies. Kasi way back 1990 and 2011, ang sabi sa studies, arthritis develops when the cartilage within the joint breaks down and allows the bones to rub together. Your joints are surrounded by a synovial membrane, which contains synovial fluid that lubricates them and prevents them from grinding together. So parang ito, yung kunyari, best example is yung legs natin, di ba? Gumagalaw-galaw siya, ganyan. So merong, to prevent yung nagkikiskisan dito, merong nasa gitna po yan, di ba? Yun yung tinatawag na synovial fluid. It keeps it from moving smoothly lang. Kasi kapag nagdikit po yan, yun yung nagiging cause ng arthritis. So, ayan. Diba, Doc? Hindi po ba yung tama?
Okay. As a medical person, we don't advise doing it. Okay?
Yes.
When you talk about later on having prevention of arthritis, it might not be substantial. Ibig sabihin, sa kakakrack mo, later on, baka hindi ka magkaroon ng arthritis, hindi. You might still have arthritis. Or probably, kagaya na in-explain ni Mitch, baka mag-aggravate pa kung talagang magkakaroon ka ng arthritis. You have to remember, Mitch, Janet, you have rheumatoid arthritis, osteoarthritis. The rheumatoid has your ligaments and your muscle. Osteo is bone, and of course, your fabulous arthritis, gouty arthritis. Pagkakain mo ng uric acid na marami, no? So, sasabihin mo mape-prevent arthritis? No. It might aggravate it further. And we do not advise cracking of fingers.
Yan. So, ayan na. Na-debunk na ang ating first myth. Okay? So, hindi naman siya directly correlated, pero hindi pa rin talaga siya advice. Kasi you might still get arthritis. But now you know kung saan nanggagaling yung popping sound na yun.
Yes. Pero yung popping sound, dahil yun sa air na lumalabas. Kasi parang, di ba, yung... Yes. Yung synovial fluid kasi it's like a
Yes.
slime po, 'di ba? Na kapag piniga mo ng piniga, pumuputok yung slime, 'di ba? So it's the same
Yeah.
as like that
Yes.
kapag nag-crack ka, may air na lumalabas. And yun na nga, kapag the more you crack it, numinipis siya, 'di ba? Just like
Mm,
the slime, kapag hinila mo, ninipis. So, wag
exactly.
niyong gawin kasi it will aggravate nga, sabi nga ni Doc. Ayan.
Yan. Okay. Thank you so much sa mga inputs. Ayan, hopefully yung mga nanonood, we will, kasi guilty of cracking knuckles as well. Getting into the
Yes.
habit of cracking the knuckles. Let's go on to the next myth. Ito naman. So, sinasabi dito na it's bad to drink less than 8 glasses of water per day. So no need to count cups. Research shows people who gulp a glass of H2O when they're thirsty get enough to stay healthy and hydrated. Water-rich foods like soup, fruit, and vegetables and drinks like juice, tea, and coffee all help you get your fill. You might need to drink more water if your urine is dark yellow, you don't go regularly, you're very active, or if you live in a hot climate. So yan, I want to ask Doc about this one. Kasi naman, people have we have this notion na parang 8 to 10 classes or even more. Pero it says here nga naman na if hindi ka naman talaga athletic or parang yung lifestyle mo naman, parang hindi ka masyado nagsusweat, parang enough na daw yun, iinom ka lang ng tubig whenever you're thirsty. And tama nga naman na yung kinakain din natin and some other ini-intake natin talaga, may kasama na siyang fluid. So, I want to ask Doc about this one. What do you think?
Okay, Janine, water is life. Okay. If you don't eat something that is bulky, okay, when you say food like meat, fish, vegetable, you want to go on starvation, you drink water, you will not die. Okay, kaya water is life. It hydrates your cells and the rest of your body system. Regularly, we ask people to drink 8 to 10 glasses. Okay. Unless you have medical problems, kidney problems, okay, vascular problems, we regulate water. But still, we require you to drink water. Okay? Mahirap kasing di umiinom ng tubig sa isang araw kasi you will increase your salt content in the body. Later on, you can create stones, infection, or even edema, manas. Diba?
Yes.
Oh, yan, Mitzi, diba? Kanina meron isang nag-comment na kailangan, guilty pa siya o kailangan uminom siya ng tubig. So, water is life.
Yes, ayan. Okay. So,
Okay, so next up, you need a daily multivitamin. You may have heard that a multivitamin can make up for nutrients that aren't in your diet. Researchers don't all agree on that point, but if your doctor tells you to take vitamins, do it. And if you're pregnant, you need to take folic acid to lower the risk of birth defects. Still, the best way to get your nutrients is to eat a diet filled with fruits, vegetables, whole grains, nuts, and healthy oils. Yan.
Agree with it, Mitch. We should take in organic or natural food.
Okay.
Vitamins are for supplements. Supplements in the sense that if you cannot get it from your food, like some of the minerals or some of the essential vitamins, then you can get it from your vitamins. You can have a mixture of vitamins depending on your needs. Diba? Diba may vitamin B12 complex tayo, meron tayong mga vitamins na may minerals lang, no? So, I agree with you, Mitz. You have to have your doctors prescribe it for you, whatever is the need. Ito sasabihin ko sa inyo, Janine, Mitz. You know Enervon. We're not promoting them, diba? It's an energy drink, a vitamin for children, growing children. minsan kasi sasabihin ng mga 50 years old, Dok, pwede pa bang inumin yan? Sabi ko, Diyos ko po, pambata yan, ba't iniinom mo yan? Lalaki pa ba ikaw? Hindi na. No? Yun na sinasabi natin, Mitz, no? You drink vitamins properly with your age and what is needed by your body.
Super agree with you, Doc. Kasi nga po, most people, they think na kailangan nilang mag-centrum every day or kung ano mang mga vitamins na tinitake nila. When in fact, kung nakukuha, if you're generally a healthy person, kaya mo namang kunin yung mga nutrients sa kinakain mo. And at the same time, yung mga vitamins kasi they're still manufactured or created sa mga laboratories. And ang nagme-metabolize yan is still your kidney, your liver. So, pwede silang mag-suffer in the end, di ba? Yung mga organs na yun. If lagi tayo nagtitake ng mga gamot and kasama na rin yung vitamins. So, yan, super agree with Doc with this one.
Pero now kasi, Michi, Janine, we advise, if you get advice from your doctors, we need it now to increase immune system, especially I know the both of you work late nights para ma-boost rin yung immune system against COVID.
Opo.
Yan. So, vitamin C. Yun.
Yes.
Kasi
Pinakita ni Mitzi kanina. Pakita mo ulit.
Ano daw? Uy, lagi itong nasa table ko.
Oo.
Ayan. Ito. Merong magandang comment dito eh. Pambata rin.
Ang cute mo talaga, Papalim.
Papalim. Okay. Naman na ating myth. Ayan, sinasabi dito na sleeping with wet hair and you go blind. So you can ask tens or millions of hows, but you won't find an answer even when you try to look at it in different angles. There seems to be no plausible reason why sleeping with wet hair can cause blindness. At least it is possible that sleeping with wet hair causes dampness in the pillow, which can be difficult to dry out and that can aid bacteria or fungal growth. Pero wala daw talagang relation dun sa pagkabulag.
It's generally a myth. Diba? It's a myth. You still have your eyesight intact kahit napasa ang buhok mo. Yun na nga, siyempre, yung punda mo, mababasa. Diba? No? Eye defects comes in different forms, no? Like, congenital glaucoma, cataract, these are genetics, no? Minsan nga, isang myth, dagdagan natin dyan yung when you read books, sleeping, yan. It will not blind you, but it will cause a bit of yung eyesight mo, myopic or presbyopic, yan. Medyo lalabo, magkakaroon ka ng salamin. Pero hindi totally mabubulag ka. Diba?
Ayan, maganda yan. Pero Doc, could you define the myopic and presbyopic for our audience?
Nearsighted and
farsighted. Hypermyopia po yung farsighted po, no?
Yeah.
Okay, next, ito. Washing sweaty hands can lead to spasmodic hands or pasma.
Common yan.
Yeah, so it's a common Filipino advice not to wash your hands right after finishing labor-intensive chores to avoid pasma. The reason for shaky hands daw. So sweaty palms and numbness or pain in the hands. Sabi, often right after pag nagplaplansya, or you'll be discouraged by your mom or grandmother to wet your hands after mo gawin yun. Tapos similarly, it is believed that taking a bath after a workout can lead to illnesses. Tapos the truth is, yun na nga, hand tremors, sweaty hands, numbness, and pain in the hands are symptoms that are often related to diabetes mellitus, thyroid dysfunction, and nervous system dysfunction. If you regularly experience such symptoms, rule out any underlying conditions by paying a quick visit to a trusted health professionals.
Yes. Tama dyan, Mitz. It is a myth. Okay. Minsan kayo kasi, Janine Mitz, di ba? When you look sa online nyo, or you tend to have a lot of time with your lap machines, o di ba? Yung mga Macs ninyo, your eyes tends to twitch. The same thing, no? So sabi ni Mitch, neurological, vascular, like diabetes, has something to do with it. So it is not tantamount to say that if you wash your hands, sinapagod ka, nag-gym ka, naligo ka, magkakasakit ka. No. It's advocated nga after you finish your gym. Diba? You take a shower.
Bath. Shower right away.
Right away.
So,
So it's a myth.
It's a myth. Kasi talagang parents, yung mga elderlies natin, pinaniniwalaan talaga yan. Myth. So moving forward, so this one, isa pa, connected din sa pawis. Not patting your sweat dry with a towel can cause you to get pneumonia. Many Filipinos believe this superstition in fear of suffering from this serious lung disease. Although, like most pamahiins, there's no scientific basis for this particular belief. So the inflammation of the air spaces in the lungs is often caused by fungi, viruses, and bacteria, not sweat left to dry.
This is totally a myth. When you say pneumonia,
It's
the
a
bacteria or the virus
Yes.
has penetrated into your respiratory system. So yun. So ito kasi outside naman yan, external no? So you can have your towels to remove your sweat, but it won't cause pneumonia. So totally a myth.
So alam nyo na, yung mga pawis nyo, hindi biglang papasok sa lungs yan.
Oo.
Nag-passive diffusion.
Oo. Di ba, myth? Paano pumasok dyan? So kawawa naman lahat na napapawisan, mag-pneumonia na.
Teleport na yung pawis mo papunta sa lungs. Ayan. So let's move on to the next. Ayun, may nag-comment. And Doc, meron palang nagpapatanong dito sa comments, nakalimutan kong i-flash kasi natabunan. Nasaan nga ba yun? About dun sa hair daw, kapag natulog ka ng basa yung buhok mo, sasakit, totoo bang sasakit talaga yung ulo mo daw?
Maloloka raw. Ito po. Ayan.
Hindi.
Eradicate.
Sabi,
Maloloko?
maloloko ka daw, sakit
Hindi.
daw ulo mo, ganun.
No.
Meron pa dito.
You'll still have your sanity.
Okay.
Find that comment anymore. Natabunan na siya. Wow, ibig sabihin ang daming nagko-comment. Pero yun, how about naman Doc, yung sasakit daw yung ulo pag naligo ng basa ang hair?
Hindi kasi ganun yun eh. Naligo ka ng basa, it's wet. When you sleep, you put pressure on your head. Mainit, di ba? So, kagaya sabi ni Mitz, is it a diffusion? Yung passive diffusion. Ibig sabihin, mainit kasi. Di ba? Pressure on your head tends to have a warm temperature. So, di ba? Warm, abrupt warm and cold change makes mild headaches. Vascular yan.
Ayan. Oh, all right. So let's move on to the next myth. Go ahead. Go ahead, Mitzi, with this.
Okay. Ito, stepping over a child will stunt his or her growth. Ito yung sinasabi nila na kapag hinakbangan mo yung bata, Yun yung hindi siya lalaki na. So yan, this superstition is common to older generations, but no evidence confirms this specific pamahiin to be true. Because as we all know, the growth of a child depends on various factors nga po that influence development, including nutrition, genetics, yung sex niya, babae ba siya lalaki, hormones, and socioeconomic status.
It's totally myth. It's totally a myth.
Myth.
Okay, myth. Paano kaya tatangkad ka, lalaki? Sabi ko nga, height has tend to be a problem with growth development, bone structure, genetic, and hereditary. So kung magiging pandak ka, swerte mo na yon. Kung magiging matangkad ka, swerte mo na rin yon. Oh, positive tayo, ha?
Yes.
Kung medium size ka, good luck sa'yo.
Yan. So,
Ayan.
na-debunk na yung myth na yan. Okay lang. Abangan mo. Depende talaga sa myth yon. Depende talaga sa genetics yon. Bata.
Yes.
So, let's move on to the next one. So, pregnancy cravings or yung paglilihi. So, this one, sinasabi na soon-to-be mothers are expected to go through a phase where she will demand for certain food or drink just because she's pregnant. So, it's called paglilihi. And they're also saying na kapag daw kumain sila ng radish or kumain ng balot, pag sinabing pag kumain daw ng balot, yung baby daw magiging hairy. Pag radish naman daw, parang magiging sobrang puti daw nung anak. So,
Bata.
ang myth dito ay, yun nga daw, parang kung ano yung kinain mo, yun ang mapapasang attribute dun sa bata. So, wala namang up until today. So, this belief of this myth is still being supported in the Filipino culture. So, may scientific studies proving that there is no link between these cravings and the baby's physical attributes. A mother-to-be's diet can have a lot of effect on the unborn baby's health, but there is no connection between eating radish and having fair-skinned babies.
Oh.
Actually, Janine, this is Filipino culture that has been passed generation for generation. But I think this is purely a myth. So cravings are innate stimulation because your unborn child is hungry. Diba? And sometimes during your gestational period, there are changes not only of the unborn child but also mother. Kasi yung hormonal change mo, pati yung pag-taste mo, nag-iiba. Diba? Depende how the development of the fetus or the unborn child per se will be strongly affecting your developmental and mental and nutritional status and craving. Diba? Minsan, diba, Janine, Mitzi, na naririnig mo, 3 buwan, hindi kumakain. Ayaw. Diba? Painumin mo ng tubig. You will still be alive. Diba? Sabi ko, water is life. But of course, we cannot accept that because the unborn child needs nutrients. Okay? So it's totally a myth. It's a folklore. Alam mo yung Filipino folklore? Yung parang kailangan sundin mo, you know, because sabi nga ni Mitzi, generation from our lolos, our great-grandfathers, they believe that. So there tends to be a certain belief.
Yung sa mom ko nga po, nung nagbubuntis po siya sa second child, yung sa kuya ko po ngayon, gusto niya pong babae. So, minake-upan niya po yung daddy ko para maging babae sana.
Kawawan tatay.
Ayun.
Lumabas ka, hindi.
Hindi po, kuya.
Oh, si kuya mo, diba?
Opo.
So, ayun, generally, it's a myth. So in conclusion, ayan, thank you, Doc. Grabe. Hopefully, pati ako, lahat tayo, talagang nabusog tayo ng kaalaman patungkol dito sa mga health myths. Hopefully, maraming nasagot na katanungan sa inyo. Although, ang dami pa rin talagang health myths na naglilipana. So, kung meron kayong mga questions or concerns about that, please feel free to just comment sa ating comment section. And you can also use late na to dapat pala nasabi natin kanina, hashtag The Sunday Health Show and hashtag VG8 Radio. So,
pero nasa ticker po natin
yun. Ayun. The ticker. So, just to say na in conclusion, so don't allow superstitions to cloud your judgment. Make your physical health a priority by regularly visiting a medical professional and undergoing health checkups as needed. Like sinabi ni Doc kanina, pwedeng annual checkups naman. Ayan. And maganda rin pong basis ng health information ang show namin. Dahil hindi naman tayo makakapunta lagi sa mga ospital, di ba? Lalo na sa sitwasyon natin ngayon. So if you have questions, it's good to actually ask it here and we have an expert, a professional to answer your questions. Ayan, so let's just read some of the comments here in our comment section. Ayan, kay Lani Padilla, very informative. Ito.
Ito na naman po.
Mag-comment ka, papalim.
Ano?
You know what's nice with our show, Janine and Mitzi, is kasi this is like your generation and Mitzi's generation will have this platform in asking me, diba? So it is your chance to go online, comment, and Janine and Mitzi will ask your question to me. This will be ongoing every week, right?
Yes, every Sunday.
So just please message us sa aming Facebook page. That's the Sunday Health Show. And don't hesitate din talaga na mag-send in ng inyong mga video message na we could feature here sa aming show. Like right now, meron kami feature for our next segment, which is health calls.
Yeah.
So later on, may mga questions pa tayo sa ating comment section. We will answer that. But first, let us watch kung sino yung nag-send in ng question or review para dito. Here we go.
Hi Doc, great day. So itatanong ko lang po, if you could tell us about the medical or health benefits ng dragon fruit since nauuso siya ngayon, mabenta ang dragon fruit ngayon dito sa Jensen. I don't know if mabenta din sa ibang lugar. But ano yung makukuha natin na health benefits? And may side effect ba ito? Or may ibang tao ba hindi pwede na kumain ng dragon fruit? So yun lang po. Thank you so much.
Yon ang tanong. The famous dragon fruit or pitahaya. You call that pitahaya? Okay. It's one of the favorite fruits and one of the most vital fruits, Janine and Mitzi, which has a lot of ingredients, which are very good, especially now. We are combating COVID-19 pandemic. Okay, we start with what? It has probiotics. Okay, it has carotenoids, which gives it the color. Okay, the carotenoid is like the lycopene of the tomatoes. Okay, it has vitamin C, Mitzi, vitamin C, vitamin E. Ayan. B-complex. Pinapakita niya vitamins. Pinagyayabang niya sa atin. And then, it has very strong iron content. Okay. It's rich in caloric nutrition, roughly around 7 grams, 7 to 8 grams. It's very good because it has very high fiber. So, okay yan sa katawan natin, especially for our gut. Okay. What else? It's good for the heart because of, what did I mention? The fiber. Diba?
Yes.
Then, probiotics, na-mention pa na, no? Because it has lactobacilli organism, which is very good for digestion. And magnesium and vitamin E. So, ang dami, di ba? Did you remember all that I mentioned? It has cancer effect, anti-cancer effect. No? It has flavonoids and carotenoids. Yeah, it has very strong anti-cancer effect. Okay, to eradicate free radicals. So kaya siya matinding fruit. Mahal yata siya, di ba?
Yes, Doc.
Mitzi.
May kamahalan nga.
So,
So, grabe, wonder fruit din siya. Bukod sa
Wonder
dragon.
fruit. I think they label it as like a queen fruit. Queen, di ba? Queen fruit rin siya, di ba?
Opo.
So, Doc, meron daw bang din yan? Parang side effect, sabi ni Papa Lem? Or parang hindi naman
With
side
all the
effect?
ingredients, Janine, magkaka-side effect, wala. Ganda.
Yes.
Oh,
Ayan,
absolutely.
Papa Lem. Nasagot ba? Sana nasagot yung tanong ni Papa Lem. Thank you so much for sending in your question kay Dr. Lee. And sobrang grabe, bibili na kami lahat ng dragon fruit pagkatapos ng episode na ito. And abangan nyo, malay nyo, mamigay kami ng dragon fruit. Biglang namigay ng dragon fruit.
Sino ba nagtanong sa atin? Tagaan? Jensen?
Yes, taga Jensen po.
Parang maraming dragon fruit doon, Di ba, Mitzi? Padala niya tayo.
Actually, baliktad, si Papa Lem pala ang dapat mag-send ng dragon fruit dito
Correct.
Ay, oo nga po, no?
Di ba, imbis
Nabudol.
na mamigay tayo ng freebies, tayo yung nanghingi ng freebies eh.
Yes.
Yan, sabi ni Papa Lem. Yes.
Mag-harvest daw siya.
Mag-harvest na daw siya ng dragon fruit. Cherries. Ayan. So, once again, we do encourage you to send in your video messages for our health calls. We will be giving you a special token of appreciation, special prize for participating para ma-encourage na mag-send ng video. Pero
May
for this
panalo na
one,
ba?
kay Papa Lem, so may winner tayo for the pag-game, pero for Papa Lem, bibigyan din natin siya ng 100 pesos loan.
Yun.
Oh.
Yes.
Oh my.
Ibang klase si Papa Lem.
Oo. So, di ba, okay na yan kahit hindi ka na sumali sa pag-game, meron ka ng load. So, maraming salamat sa iyong question. And like I said, kanina nga pala, yung mga nagtanong dito sa comments, ipa-flash natin some of them. Itzy, basa.
Okay, galing kay Miss Rona Del Rosario. My mom shared something that I consider a myth. In her time, Royal, the soft drinks, is considered a medicine whenever someone experiences stomach ache or fever. What do you think is the logic behind that? How would you debunk this thinking if you were in her time, early 1970s?
Carbonated drinks kasi make you burp.
Yeah.
Diba? So, pag nagkaroon ka ng obstipation, parang nababarahan, so when you drink soft drinks, okay, like we have a brand, di ba? Yung number, alam mo, tapos up. Ayun natin sabihin kasi that is sponsor. A number and up, you know that, Mitzi?
Yes po, yes.
Like yung bottle. Di ba pag ininom mo yan, magbo-burp ka? If you drink your favorite soda, di ba? Alam ni Janine rin yan. No? Pag uminom ka, pag malamig, nilagyan nyo ni yelo, magbo-burp kayo. The burping tends to help in patients who have obstipation. Obstipation is signs and symptoms para kang nagko-constipate. Baka feeling nila nakakatulong.
Okay.
But it's not.
Doc, ako naman po may tanong po ako. Kasi kung yun naman obstipation, yung when it comes to nako-constipate, yung iba naman po, di ba, they drink Gatorade. Di ba? Pag nagtatai po sila, pag nagda-diarrhea. Pero sabi nila hindi daw po advisable yung Gatorade. Parang what's best is yung Oresol, yung merong sugar and parang may small part ng sugar sa water.
For your generation, Mitzi, I can tell that I'm not a fan of sports drink. So you have to be careful, okay?
Opo.
So yung sinabi mong pangalawa, Oresol, di ba? I would
Yes
like
po.
that. It's better. Okay. Kasi ang mga sports drink, Janine, hindi regulated ang, what do you call that, electrolyte controls nila, yung contents nila. So, hindi mo alam kung how much is the sodium, the chloride, and everything. Baka mag-over ka. It gives you a bad homeostasis with your body.
Water na lang.
Oo, water is life. Magiging sponsor natin yan. Alam mo, Janine,
Oh my.
Sponsor very good natural spring water from Turkey. Oh,
Wow.
Oh my God.
wow. Secret yan.
Wow.
Secret reveal.
Secret
Nagulat
na
ko
reveal
rin.
na. Diba? Pa-serve na.
Yes.
Ang galing naman.
Okay. So,
Ano
Alright.
ba?
Overtime.
Overtime na ba tayo? Marami kasing mga comment, eh, oh.
Oo, so mukhang mag-move na tayo sa ating next
opo.
segment.
Okay. So yan, that's right po. Ngayon naman, dahil kumapit kayo hanggang ngayon sa aming episode, ito yung ating 17,000 viewers. Sa aming episode, we will now be announcing the answer sa ating question kanina and announce a lucky winner from the viewers. So, we have picked out yung unang sumugot kasi di po kami makapag-pick randomly. Ayan, yung nag-send ng tamang sagot sa comments. So, ulitin lang po namin yung question. What is Dr. Lee's specialization? Yan. So, the correct answer is urology.
Baka Jenny, kala ko may sasagot ng neurologist.
Ito.
Mayroong sumagot ng neurology. Marami.
Oo.
Maraming sumagot ng neurology actually.
Katunog kasi, di ba?
Katunog kasi.
Nalungkot si Janino. Kakasabi lang.
Kasabi lang. Pero okay lang yan. Marami
Okay
pa
lang
tayo
yan.
games in the next
Opo.
episodes. And
So, Doc.
si
Ayan.
Doc ba mag-a-announce or ikaw na, Mitzi? Parang hindi ata.
Ikaw na mag-announce, Mitz.
Oo, si Mitzi na lang mag-announce.
Okay. So, ang unang-unang sumagot sa ating comment section. Oh my. Kilala ko to. Ito. Congratulations, Lance! You just won 100 peso loan. We will be messaging you on Facebook for further instructions.
Congratulations,
Ayan. Siya po yung unang-una. Sumunod si mommy ko. Sayang. Ayan.
Alright. So, next episodes, ganun din po ang mangyayari. Please, you will have to answer and type in your answers or comments and actually share our live dito sa PGA Radio. Yan. Share nyo sa inyong mga timelines and share nyo na din sa inyong mga friends para marami silang matutunan patungkol sa health and wellness. Okay, so we want to ask Doc Lee for some last words or comments para dun sa naging segment natin today, and kung may mga message, kung may message siya sa ating viewers when it comes to health myths, health and wellness in general. Yeah.
Okay. First and foremost, I like to thank the both of you to accepting to be my host. Janine, the golden voice. Mitzi, the voice royalty. Dr. Joseph, forget the voice.
Oh my,
To all our
Doc
televiewers.
talaga.
Huwag ka na umirip, Mitzi. Okay na yan. Gumawa ako ng titulo sarili ko. Okay. I'm excited, and hopefully for our televiewers online, hope you follow our Sunday Health Show every 11 o'clock to 12 noon before you take your lunch break. Diba? Pakinggan nyo muna kami. Pakinggan nyo muna ang mga sasabihin ng aking mga magagandang co-hosts, si Janine and Mitzi. And always keep safe. Okay? Then, of course, follow the golden rules. Sinabi natin, sleep, eat well, exercise, and live a happy disposition. That is the secret of being ageless. Like me.
Yes.
Nasingit talaga, Mitzi.
Yes, Doc.
Yes, Janine.
And perhaps, Doc, you would like to promote your social media accounts or meron kang page or shows if you have other shows na you want our
Naku, wag.
viewers to.
Okay na, ito na lang i-promote natin. Bahala na sila kasi sabi mo, hanapin na lang nila ako, no?
Yes, pakistock na lang si Doc.
I-stock mo lang ako.
Pangalan
Si Mitzi tontuwa.
Ay, teka, meron palang humahabol na tanong dito. Kasi nasagap. Ayan.
Erotic coffee.
So, yung
O sige, ano natin dito sa platform, no? Papalim, erotic coffee, oo. Sa next episode. No? Then the only show that I have with VG8 and Creative Voice Production is Quarant Talk every Monday, Wednesday, and Friday, 9 a.m. to 10:30 a.m. Yun. Baka magalit si Mentor Pocholo. The rest, bahala kayo mag-stock.
Ayan. Kasi sa Quarantalk, nanonood ako na po-promote din nila yung erotic coffee. So,
Yes. Gusto nyo rin ba dito sa atin?
pwede naman po i-promote, Doc, if you want. Or
Oo,
you
pwede naman.
promote
yes.
ng mga products.
Sure.
And syempre, yung mga pinopromote na products ni Doc yan, for sure,
Mhm.
approved yan. And then
Oo.
check
Tsaka
it
yung
out.
Janine, Mitzi, I think one of the products that I'm endorsing now, which is a berry, I can announce the name na. Kasi they will be our partner. Organic Acai. Have you heard about it? Ooh, sabi ni
Acai?
Yes.
Parang wonder.
Ano, Mitz? Okay ka na? Dami na, no?
Oo nga po.
Parang nililista na ni Mitzi yan isa-isa, di ba? Lista mo na. Para sa mga next episodes. Ayan. So,
Opo.
thank you so much, Doc Lee, for sharing with us yung advice as well as yung mga platforms na pinromote mo kanina. So, let me just promote naman my social media platform for FB. You can go to my FB page. It contains my voiceover samples if you need for your voiceover needs or voice acting needs. Just go to @thegoldenvoice.ph. Yan. That's my page and may mga song covers din doon. And for YouTube naman, you can just type in Janine Santos, The Golden Voice. Ayun din, nandun na ang aking mga samples for voice acting, dubbing, sing dubbing, and song covers. Ayan. And as well, I would like to congratulate Sir Choi kasi kahapon, CVAP Batch 4 na. Wow, ang bilis ng
Yes.
galing, grabe.
Opo.
Yan. Congratulations. So, nag-start sila kahapon. CVAP Batch 4 ako, CVAP Batch 2, si Mitzi, CVAP Batch 3.
Batch 3.
Yan. So, sunod-sunod yan. So, magkakaroon pa ng CVAP Batch 5, 6, 7, 8, 9, 10. I don't know kung
Ako forever batch.
forever Pero ayun nga. So kung gusto niyo maging isang voice artist, katulad nga ng sinabi ni Doc Lee, nag-training kami, you have to consult a professional. And pagdating naman talaga sa voice acting, sa voice artistry, wala ka ng ibang hahanapin pa kundi ang voice master ng Pilipinas,
Yes.
Sir Pocholo del
Exactly.
Gonzales. Yes. So, ano na, mag-register na kayo. Or di ko alam kung pwede pa kayong humabol sa batch 4. Pero
Oo,
kung
pwede pa yan, ate.
pwede pa daw. O,
Ako
secretary
nga
ata
nun, humabol lang din eh.
siya, humabol daw siya. So, graming din pati sa registration. Pero, you could visit www.certifiedvoiceartist.com and register. Tingnan nyo kami ni Mitzi. We only wanted to be voice artists and we wanted to learn how it works. Pero ngayon, nasa online radio kami and
Oo,
we're hosting with a celebrity urologist pa. So, wala lang.
Mm-mm.
Parang, ang galing. You get more than what you actually wanted. So,
Mm-mm.
that's amazing. Ayan, so
Sumobra pa
join-
sa expectation.
Correct. And we would also want to promote, of course, our home station, VG8 Radio. Napakadami ng magagandang shows sa VG8 Radio and dumadagdag palalo. So please
Mhm.
visit www.facebook.com/VG8Radio. Ayan. Alright, so Mitzi, it's time for you to promote.
Okay, ako naman po. Kindly follow me on Instagram for updates on kung ano mang ginagawa ko. And on my Facebook page, Mitzi Aguinaldo. I usually post my covers from my YouTube channel sa Facebook page and certain updates din sa aking Facebook page. And nga pala, I would like to promote every Wednesday I am part of the Voice of the Parents show. Well, voice of the parent siya, pero ako po yung darling bunso nila. So, ako yung kunyari may mga nag-aaway. Ako po yung, okay, chill lang po tayo.
Referee.
Taga-Batingaw.
Ayun.
Ayan. And also, ako nga po pala, before I forget, I'd like to promote CVAP din po ulit. Ayan na nga, kanina sabi na nag-start na po ang batch 4. And kung gusto nyo pong humabol, kindly message us or kahit si Sir Choi po mismo, anyone from CVAP. And also, Creative Sound Studio, Creative Voices Productions, and Voice from Home. Ayan.
Ayan. And once again, maraming salamat sa aming mga viewers. Thank you so much kay Sir Choi for giving us the opportunity to have this wonderful, wonderful show. So, yan. Ito na. Ang ating tagline. Take it away.
Okay, sa ating mga online viewers, sa ating premiere ng The Sunday Health Show, hopefully masubaybayan nyo kami next Sunday and we assure you we'll give you more segments, no? Ito naman dalawang kasama ko, si The Golden Voice Janine and Mitzi The Voice Royalty at ako. Wala nang bayaan mo ng voice ko. Then kami ang magiging ninyo tatlong individual na magpapainit ng inyong pre-lunch or bago magtanghalian patungkol sa mga health issues, mga health docus na kailangan nyo at mga health advice bago kayo maghapunan o mag-lunch. Ako po si Dr. Joseph Lee, ang inyong urologist at medical consultant dito lang sa Sunday Health Show. Take it away, girls!
Ayan,
See you
maraming
next
salamat.
Sunday.
And see you next Sunday.
Sunday. Dito sa
Again,
The Sunday.
The Sunday Health Show.
Show.
Yay!
So, ano kayo, tutol yung salita mo. Tapos,